Stop recording. Can I welcome you all to the meeting of the Scrutiny Performance Panel Adult Services. Welcome to all the meeting, welcome to the officers, and welcome to Richard, who is going to give us a presentation, and Louise, who is our cabinet member. Thank you all, and welcome to Tony Bed, who's welcome back.
Thank you very much.
Right, item number 1 is apologies. Liz?
We've received apologies from Councillor Alan Jeffrey and Yvonne Jardine.
Okay, any other apologies? Okay, item 2, disclosures. Are there any disclosures of personal and prejudicial interest? None? Thank you. Item 3, prohibition of the whipped votes and declaration of party whips. I take that as read. Item number 4, minutes of the previous meeting. Okay, we've got page 1, page 2, page 3, page 4. We've got the letters then on page 5, page 6, page 7, and page 8. Can I take those as true record?
I move you, Chairman.
Have I got a seconder? Thank you, Hazel. Okay, public question time, item 5. Sorry.
Sorry, Chair, are you taking any matters of rise?
Have you got any? Yes.
Well, it's just the reference to the individual representation that was made by one of the family in dealing with learning disabilities.
Okay.
Is that in order, Chair?
Yes.
Yeah. I mean, when I read that, the thoughts that went through my mind were, first of all, how many families or people are in the same position in Swansea, roughly. I mean, I'm conscious of the possibility that we still might be suffering from what you might call the overhang of the Hensel emptying years ago, when young people were brought into various situations, and of course they're now quite elderly people, and whether that's a factor. But the third thought that went through my mind was, in terms of upskilling the kind of accommodation to which people with these needs could go. There was an experiment, and Dave knows about this because we've talked about it before. There was an experiment in Gorsinen some years ago whereby people with predictable physical decline and needs therefrom would be provided with housing and other accommodation. And I wonder if that model might apply here, particularly if we could reskill and adjust parts of the housing stock, particularly the sheltered housing stock and others, that the City and Council either does have or could soon acquire, so that you have a package of support that is tailored to the needs of individuals with learning disabilities. I'll stop there, Chair. So much as I've spoken.
I don't know if Dave or Amy want to respond to that. Amy, I wondered as well, I know we were talking recently about the Shared Lives sort of initiative with SCVS. I wondered if that's another potential option for this sort of situation.
Yeah, it's a whole different it's a whole mix of housing options. So we talked about last time whether it's individual units that people have support at, whether it's supported living. I just tried to get the stats. Actually, for your first question, what we might have to do is follow after the meeting, if that's all right. I believe it's around the 52 number in terms of individuals, but there really are different circumstances for each person. So some people might be, like I say, wanting a different style of supported living, and Shared Lives, as the councillor mentions, is an option where people have different options, housing options of living, or people living with them to help as well. So there's different approaches that we're applying, and down to individual circumstances as well. And it changes over people's life courses in lifetime as well, doesn't it?
I think a lot of the gentleman that we were talking about, I don't think he's actually left home. His parents are getting older, and I think that's a situation that we have to be looking at, isn't it? Okay, are you happy with that?
Yes, Chair. I mean, nice to know if we maybe able to eat into the 52 over the next year or so. Right, with accommodation.
Your mic's not on.
Yes, it would be nice to know if how we progress with the 52 in terms of what we've been able to do for them and the range of need that between them they might need on an individual or collective basis. Thank you, Chair.
Perhaps we can ask Amy to maybe respond to that in a later meeting. Thank
Yeah,
you.
that's fine.
Thank you. Okay.
Yes.
No questions, then public questions today. Right, actions and direct payment. Louise, are you going to introduce this on?
Not particularly. I think it's a very, very comprehensive report provided by Richard, so I'm very happy to hand over to him to run through it. You know, there's a lot of really good work that's being done in this area, and very grateful to Richard and the officers. So I'll hand over to him.
Thank you all. I can't take full credit for the report. That's down to Amy, who oversees everything I do, in fairness, and gets it done right. But overall, the report submitted is in response to the Welsh Audit Office published recommendations following their review of direct payments across adult services in Wales on the 6th of April this year. And without going too much into the background of direct payments, in a nutshell, direct payments are a way to mitigate assessed need for people who have care and social needs. So as long as there's an actual assessed need, then that can be met by a direct payment. And of the 10 recommendations, I'm very confident in saying that we are meeting certainly our requirements as a council, and probably exceeding in some areas as well. If you'd like me to go through the recommendations one by one, I shall, and discuss then and answer any questions that you may have in relation to each recommendation. So
I think that would be useful if you went through all the recommendations. Thank you.
thank you. So starting with recommendation 1, local authorities should review public information in discussion with service users and carers to ensure it is clear, concise and fully explains what they need to know about direct payments. Our response to that recommendation is certainly co-productions at the centre of direct payment development in Swansea. And that's down to personal relationships that the team and myself have built up with the co-production network. And in fact, I'm actually meeting some of them next week for a coffee to discuss where we go with things. It's that level of personal interaction. A direct payment forum has been created, and arrangements for developing direct payment services are developed co-productively. So everything we do, we run past the direct payment forum, because we're very keen to understand that the people who matter in this equation are the people who receive the services. That's the long and short of it. And it's, you know, in an ideal world, we've got the training, possibly the expertise to deliver what is needed, but how it is delivered should be informed by the people who receive that service. And that's the basis from which we work in principle. So we've developed a carers and practitioners information leaflet, again, co-produced. We're in the process of developing and updating a website. We're looking across Wales to see, you know, where best practice is working. Flintshire have a bit of a lead and a little bit ahead of us, annoyingly, at the moment, which hopefully we're going to catch up and surpass. Via the direct payment forum itself, I say we meet monthly, and there's good representation from officers as well as people receiving support. And that's an open dialogue which constantly and consistently informs the process. By way of example, you may or may not be aware, we've had historic problems with the payroll provider, which have been particularly difficult. I came into post in. Yes. The point I was going to get is that we have co-produced the tender exercise, and that was done with members of the forum, and they were an equal part of that tender exercise, and that was a really valuable input to inform the process, because again, it's the recipients of these services are so important in what we do. And again, communications that go out, it's very easy sometimes to look at communications and think they make sense. But when you're receiving them from a point of perhaps not being a council worker, they make no sense at all. So we're very conscious of the communications that go out are run by people who will receive them, that they actually make sense to the end destination. That covers recommendation 1 and ties into...
Sorry, Richard, do you want questions on each?
That'll be fine. If there's any
Yes,
questions, I do
Or do you
apologize.
want it at the end?
No, I'll do questions after each recommendation. So
Okay,
if there are any questions, please, for recommendation 1.
lovely. No, I've got a question. The leaflet that you produced, is it possible for us to have a look at that leaflet as a scrutiny board?
Yes, most certainly. The leaflet we co-produced initially, and it'll come on further in report. We've just started a direct payment steering group, which ultimately we will co-produce. And we're conscious at the moment that that all the directorates of social services have an equal buy-in to it. So it's not quite ready for publication yet. It's going to be run by the steering board, and then once it's then signed off by the whole of the directorate, it would be relevant to share. Because what we're trying to attain with direct payments is a one council, one service response.
Great. Somebody, Cheryl, you've got a question?
Yeah, thanks, Richard. Just a quick question. When you were saying about some of the information that goes out, we do take it for granted, don't we, when we sort of like put it in corporate terms. But you said that you were very conscious that you wanted it to be easy to read then and understandable by people who don't work for the authority. So who do you get to check that? Are you with me?
Yeah, absolutely. We work closely with the Direct Payment Forum, and there are key members there, particularly Chris Law and Joe Phillips, who on a very quick turnaround, if we've got something urgent that puts out, I can actually email that communication, run it by them, and they can come back with observations that we can then take into account. Yes, with the Parent Care Forum. Of course, if it's a more lengthy procedure, we'll put it to the whole forum and get feedback from that and amend the communication accordingly.
Good, thanks.
You happy for me to move on to? So recommendation 2, local authorities should undertake additional promotional work to encourage the take-up of direct payments. The council response to that is a strategic manager post. My post actually has been created to promote the take-up of direct payments and ensure that these are optimised for people where this option is preferred. I think there's been, historically a little bit of misconception, perhaps myths, fear perhaps of direct payments. So we're working actively now to reduce the fear, to eliminate the myth, and to show that direct payments are a viable and meaningful part of the answer where support is needed. We've, as we touched on, information leaflets. We've created information packs and an information session actually to deliver to social work teams, which we have delivered, and we're in the process of continuing to deliver, to the point that we were down in Swansea University last week and the month previous, delivering direct payment information to student social workers. So to catch them right at the start and have the conversation about direct payments embedded really early in their psyche so that it can inform their practice later on. As I touched on, we're developing the council's website, and there's ongoing promotion of direct payments. We've linked up with some fabulous support within the council teams to support direct payments, linking up with Workways, the employment hub in the city centre. We've got a regular stand there. And if we go to the opening of a paper bag, if it's there and we can promote it, we'll get out and promote it and see the viability of direct payments and why they make sense for a lot of people, supporting voice, choice and control, which is all important. We are looking to fast track processes for direct payments for carers. We've done that in quite simplistic terms most recently, where carers have asked for some support, and the traditional council response is very often that, you know, you need 3 quotes to do this, which sometimes for someone who's already beleaguered is a big ask. So we've used a common sense approach and looking at if it's simply gardening support, what is the standard hourly rate for gardening across Swansea, generalising and making a direct payment in line with that, so that the person themselves can arrange that support that suits them at the time that suits them. Is there any questions in relation to response number 2?
Just a comment, if I may. The LACs are very involved with this direct payment because they've got their feet on the ground and they know what's happening in the communities.
We work very closely with the local area coordination team, particularly when it comes to identifying personal assistance and people who need support within the area. So by a coordinated approach, we can maximise then the support that we can offer individuals, and they're a very important part of the teamwork generally to provide that support within communities.
Thank you, Richard.
Thank you, Chair. This may be a daft question, but as some colleagues know, I tend to ask them normally. How would you see the extent of the knowledge of the way the direct payments have developed among other parts of the wider care team? I'm thinking particularly of NHS staff, primary care staff. Would they have a reasonably good and up-to-date knowledge of the ability, of the power of direct payments to fit into maybe a problem that they're struggling between them to solve?
It's a really good question, and I think part of this is answered by the Welsh Government's consultation at the moment regarding continuing healthcare and looking at direct payments being conjoined with continuing healthcare and being a viable option. But in relation to practitioners' understanding of it, we are delivering our direct payment information session to the Traumatic Brain Injury Service at Morrison Hospital next month. And we liaise regularly with the hospital social work team as well. They're on our to-do list for information sessions. I think it's a slow burn process. I don't think we can educate everybody overnight, and I don't think we can change mindsets overnight. We are working hard on producing some qualitative data, but we're also looking to increase our quantitative data, and we're looking to increase our qualitative data. By that I mean stories. We've got some really good stories of where direct payments have made a significant difference, positive difference in people's lives. And I think by circulating those stories, by airing those, by people telling their own story of what actual difference it made for them, that I think will be one of the most powerful ways that we can change the dialogue in relation to direct payments.
Can I just come back on that for a minute, Chair? In terms of what you might call the average level of understanding in the average GP practice in Swansea, I mean, would the average GP practice know about this scheme and know its potential and its abilities, or is it something that not many GPs get involved in plugging into in order to assist families and other groups with needs?
I think you're right. I think we have to be mindful of how we access direct payments, and how we access them is via an assessment by a social work practitioner. So it would be great if people could be informed of it prior to even coming to the assessment. I think that's huge, and part of our leaflet circulation should start to address that, and our website update should start to address that. We work closely, as I say, with the local area coordination team. We're out and about, and then now got a knowledge of direct payments. So again, I think that's a part of that expansive rolling out the knowledge, rolling out the information. And the other thing that we are doing, which in some way can mitigate what you raise, is that we've got a pilot running at the moment of the community initial assessment team, where we allocate the direct payment advisor out at the very start of that conversation, the what matters conversation. And the reasoning behind that is that the direct payment advisor can inform both the practitioner the client receiving support and the wider family. And again, that should in time pay dividends. More than happy though, as I say, if there are opportunities to deliver our information, we work with Tony Clogie who's part of the health board. I was in a meeting with him discussing direct payments just yesterday. We are more than happy to deliver direct payment information to whoever would like to receive it.
Ellen, you wanted to come in?
Sorry. Sorry, apologies. Yeah, I'm just thinking about the in the broadest sense of the message and the conversation at the earliest point around getting away from the conversation around you need a little bit of domiciliary care at the earliest point in the GP practice. I think that's a really valid point. I think we're getting there, and I think the direct payments team are very supportive in the front doors into common access point into the council, but also in the front door coming out of hospital where the triage takes place. We've really strengthened those functions. So I think in terms of the general understanding in the community services and primary care services, I think it's probably a lot higher than it was as of direct payments. And I think the myth busting thing is really important, because I think there's a conception that was a lot of head work for the person who's trying to have the direct payment. I think that myth busting has taken place. And I think in terms of primary care and community health and social care integrated services, I think there's a much closer hand in hand working. I think there's still some work to do around GP practices, but I think the dividends around having that earliest conversation with somebody about direct payments just being in people's minds, I think that's a really valid point. And I think you're right. I think we've come 100 miles and there's still a way to go, but I think an awful lot of progress has been made.
Thank you, Helen. Anybody else got any questions for Richard on this particular No. Okay, thanks, Richard.
Thank you. Moving on to recommendation 3 then. Local authorities should ensure advocacy services are considered the first point of contact to provide independent advice of direct payment service users and carers. This is an area where we recognise there's further work required. Adult Services has commissioned advocacy services to meet obligations arising under the Social Service and Wellbeing Act. Part of the way that we've looked to mitigate this ask is, as I earlier mentioned, the community initial assessment pilot that we do where we allocate in an advisor right at the outset. Now, albeit this isn't independent advocacy in its truest sense, there is a breakaway from the practitioner that the client can rely on someone through the whole process to get some relatively independent advice on what it is a direct payment is and how it can work for them. And as the staff on my team are certainly trained and equipped to do that. Obviously, if somebody wanted independent advocacy, we could facilitate that. But this is an area, as a council generally, we understand further work is required. Any questions on point 3? Any
questions on number 3? No, Richard, go on to number 4.
Going to point 4 then, local authorities should ensure information about direct payments is available at the front door to social care and include in this initial discussion on the available care options for service users and carers. We've actively now introduced measures to improve knowledge and understanding of direct payments across the social work teams, as I earlier alluded to with the ongoing training. In addition to this, we do drop-in sessions, so practitioners can come to drop-in sessions virtually, obviously, these days, or in the team. There's an open invite for people. We have a team day in the Civic Centre every Wednesday, so practitioners do drop in and ask questions there, but they've also got access to the team at certain points during the week that we can facilitate what is happening with the direct payments, specific cases and specific questions around direct payments. And that does seem to be working well.
Any questions on that? No, Rich.
Okay. Thanks. To continue then, in relation to point 5, local authorities should provide training to social workers on direct payments to ensure they fully understand the potential and feel confident promoting it to service users and carers. I think I've covered most of this in my earlier responses. And I'm particularly pleased, as I said earlier, that we're tied up with the Swansea University delivering education to student social workers. I think, again, you know, a bit of a slow burn process, but it's investment for the longer term. These people are going to come out and they're going to be confident at the outset in looking at using direct payments, but we're not shy in shouting the availability of direct payments, and I think that work is starting to pay dividends. Any questions in relation to recommendation 5?
Nobody's showing, so.
Okay. Moving on, in recommendation 6, work together with Social Care Wales, the All Wales Direct Payment Forum, to develop joint recruitment and retention plan for personal assistance. I think as a department, we're really proud at the moment of where we are with recruiting personal assistants. Across Wales, the social care workforce is in difficulty, and that's no secret. So we took the step of recruiting a peer coordinator, a personal assistant coordinator, so a defined role with a view of identifying, recruiting, training and retaining personal assistants. And in 3 months, we've identified some 200 now personal assistants who are prepared to work in the city and county of Swansea, which is no mean achievement. We've tied a lot of this work up with key partners, and that is, again, paying dividends. We work closely with Swansea Council of Voluntary Services micro enterprises, and we're looking to see where we can capitalise on this identified, the extra people identified as available to work in the creation of micro enterprises, especially if we can deliver them locally. We just started a recruit local campaign, which we delivered at Pontylice, and thanks to Councillor Lawson, we're going to deliver in Davati shortly, with the idea that if we recruit local, we find local people to help local people, and there's a lot of reason for doing that. It makes environmental sense because people aren't travel. It makes community sense, building resilience within the community. You know, because, for example, on the way to deliver some care, you know, Gladys picks up a loaf of bread for someone on the way, and they get chatting, and this is what happens. And you know, what we can also do as well is look where we've got a personal assistant, and we haven't capitalised on this yet. You know, if someone needs some social care support, it doesn't necessarily take 2 personal assistants. 1 personal assistant could take 2 or 3 people out, which in turn increases their social out. So it's a win-win. There's been some look to the rates again with relation to retaining personal assistance and recruiting in the first instance. So the DP rates now are £14.10 gross. It's been raised to that. So it allows then employers, the clients, to pay up to £11 an hour for personal assistance. And we do promote the council's stance of the minimum £10 an hour. We can't dictate that because, of course, clients are actually employees in their own right. But we do support and promote that, and we haven't had an incident yet of anybody refusing to do that. So that's great. Is there any questions in relation to number 6? Yeah, move on. Sorry. Sorry, so moving on to point 7 then. Recommendations: clarify policy expectations in plain accessible language and set out what direct payments can pay for, how the application assessment processes, timescales and review processes work, how monitoring individual payments and the paperwork required to verify payments will work, how unused monies are to be treated and where they can be banked, and how to administer and manage pooled budgets, and that these are reviewed regularly, at least every 2 years. We're well underway on this, and partly with the formation, as I say, of the new steering board. The direct payment policy is under review and is being worked on. The monitoring and management generally of direct payments is well underway, and we've worked tirelessly with our WWCIS colleagues to actually change some of the entry parameters. So it actually means, and bear with me because I'm not brilliant on computers, but you can only ask what's in there. So we're making sure that what's in there is what we need. So that's what the practitioner is actually recording. And that actually means we can pull out then what we need, and then we'll be able to give you some meaningful data as to what is happening, where it's happening, and why it's happening. So that's point 7. Is any questions on point 7? Moving on then, point 8, and this is more for the Welsh Government, is to ensure that people, and we touched on it earlier, if you remember, in relation to continuing healthcare and direct payments, this is an ongoing process with the Welsh Government. We're in consultation with local authorities. We have submitted a comprehensive response, collating evidence from all departments to the Welsh Government, which should inform the direction of travel in the future. Any queries on point 8? So point 9 then, work together to establish a system to fully evaluate direct payments and captures all the elements, process information, promotion, assessing, managing and evaluating impact on well-being and independence, managing and evaluating impact on I do apologize. I think I've touched on a lot of this. You know, some of the key metrics that we're looking to achieve, we should have by the end of the month. It's a laborious task, but it's so important because the figures say a lot, but I mentioned earlier the importance of the stories. And I think unless we have the stories from people, the actual feedback from people, the direct payments are working, then we don't know if what we're doing is any good. So I'm very keen to engage, and we do ongoing, and will continue to do so, that people receive the support to ensure that what we are doing is fit for purpose, and if not, what can we change to make it fit for purpose? We already report through PNFM, direct payment performance, but I'm confident in the coming months we'll be able to report far wider than the current reporting requirements, and we'll have a far bigger picture of how direct payments is working across the board.
Sorry, can I? Oh, Tony, go on. Sorry, Sue, I jumped in there, and I apologise for being so late, but I was going to ask you a question. Let Tony go first.
Okay, thank you, Jeff.
Thank you, Chair. I mean, as the discussion's gone on, thought that's come into my mind was whether we have a picture of what you, for want of a better word, you might call the categories of the users of direct payment services. I mean, earlier on we were talking about someone with learning needs that was having difficulty finding housing. I mean, would we know, for example, how many people with learning disabilities are accessing direct payments as opposed to people with elderly needs or acute ongoing care needs? Do we have that kind of breakdown?
Yes, we do, and each department has its own direct payments and access into direct payments. So there are free, fair access to care panels, which are the mechanisms to get into the direct payment team. And a lot of this work at the moment is overseen and accounted for by the finance department. So I get some of that information. What we're looking to do is put all this information together from the finance department, from WWCIS, so we've got a far broader picture. At the moment, for example, we've got to date 492 adults on 4 weekly direct payments. It's just over 500 in total. 492 total, just over 500 in total when you consider monthly payments. They're made up of 366 adults and 126 children. Of course, there's further subcategories, as you rightly say, and I apologise, I do not have those figures to hand today.
Okay, Amy.
Can I just come in on that? Just to let you know, as a scrutiny panel as well, you see our performance reports from adult services, and we always have some information on that. It's high level information, so we can break that down further if you'd like as well.
Thank you.
Sorry, Sue, can I come in now or?
Hold on a minute. Are you happy?
Yes, I mean, if there's a suggestion that we can refine the data, so we've got some ideas of categories. I'm thinking in particular that the world's going to be changing fairly quickly. You know, some people are getting older. As we've seen, the issue of learning disabilities is probably still a latent problem for us to deal with. And it's getting some grasp of what are the needs that the direct payments are rightly meant to try and address. And people with epilepsy, for example, is one detailed category, and David will know why I use that example. But I mean, there may be other developing social and health issues for which direct payments with a bit of tweaking might be far better than the alternatives that we're using at the minute. Thank you, Jane.
Thank you. Jeff, do you want to come in now with your question?
Yes, again, I apologise, and I probably missed this. I missed about 15 minutes of the meeting trying to get in. Yeah, with these direct payments, you know, with regards to identifying, you know, what they're actually being used for, must be a minefield and so on. I'm sorry if you already covered this, but, you know, we've got direct payments that could be used, shall we say, for, shall we say, the private sector and so on. And I must admit, you know, when I started in the council about 14 years ago, there seemed to be a push not to use direct payments. You know, I think you started off and said somebody said they come 100 miles actually since then, but people can actually use these direct payments for, well, you know, in a phrase, really, anything they actually want to. So how do you capture everything that these direct payments are actually used for? I can understand perhaps the, you know, the health service, you've got some sort of working relationship with, and, you know, the local authority, but what about actually using it for, you know, personal assistance? How do you capture that information at the end of the day?
Great question. You're right. This is the nice thing about direct payments. The reason that it grew following the time that you said when perhaps they weren't so popular is the Social Services and Wellbeing Act, and that's promoting voice, choice and control for individuals and actually having a say in the care and support that they have. So a lot of the decisions on how direct payments are spent, providing that's an assessed need with identified outcomes, it's really how long is a piece of string. I mean, it's down to the individual and sometimes the practitioner's imagination, especially when it comes to well-being. So when you've got things like personal care, well, that's very easily categorized, isn't it? That someone needs, you know, getting up in the morning, perhaps changing, toileting, and made comfortable, perhaps some food. That's a very easy one to quantify and how much support is delivered in that aspect. I would say the rest, we could get some snapshots of what is delivered, but generally it's in line with the outcomes identified at that what matters conversation, and that can change as the weeks go by. So I don't know if you know, and forgive me if you do, but there's a great flexibility with direct payments. So for example, if someone is assessed as having an hour's need once a day or 2 hours once a day, well, say for example, for a week a family member comes to stay with them, they don't actually need that, they can build those hours up and spend them in an increased way later on. So maybe have half a day support or something else. So as long as it's in line with their outcomes, direct payments can be adjusted, I guess, then to suit the person's needs and wishes. It's all ultimately about supporting people to have the best life that they aspire to, supporting people to feel safe, supporting people to achieve. And anything within that, we'd look at it with a practitioner and we would actively support that. Does that answer that question enough?
Well,
Are you happy, Jeff?
Sorry, it does in a way, and perhaps I don't know enough about them really. I'm just really looking at how you capture this information, because it seems to be extremely flexible, shall we say. My mind revolves around, are they being used properly? Are they being used for what they're for? Are we capturing where the money's actually being spent and so on? And really, are the clients actually having a good deal out of it at the end of the day?
Can I respond to that? I think this
Louise.
is where what Richard was saying about those personal stories come in, will be really helpful to people to share what they've used their direct payments for, and and how much of an impact that is making. And it's that, I mean, we can, I suppose, with difficulty get that quantitative data in terms of categories and things like that. But I think unless you sit down and talk to people and get that qualitative data, that's going to make a lot more difference to answer that sort of question.
Thank you, Louise. I think everyone is individual and the different needs are well, huge, aren't they? And if they can give anybody help to be so-called normal in normal situations, I'm all for it. Okay, are you happy, Jeff?
Well, happier, yes.
Okay. We look forward to the examples from Richard.
Yes, thanks. I mean, if it does assist in relation to the first query, I can tell you that on the weekend in the 20th of November, direct payment hours provided were 8,696 for that week. So that's the level of sort of support that went out. On a school holiday, it could be as high as 35,375 hours provided. So I think flexibility, as Councillor rightly said, is the key to direct payments. There's an element, I think, historically, of almost a big brother approach to support that's given. And perhaps one of the benefits of direct payments is that it's, this is promoted actively by the Welsh Government, is that where there's an assessed need, that people take charge of their situation and they use that money wisely to support their well-being and actively target their outcomes. So the whole ethos of direct payments is individual responsibility, individual voice choice control, and supporting independence. And I certainly wouldn't want to be punitive and sort of overly judge. Having said that, I do know, for example, that where direct payments are reviewed, and this probably helps to answer your question a little bit deeper. Direct payments are reviewed regularly. They're reviewed, are they fit for purpose? They're reviewed particularly, are the outcomes being met? And then where they're not, can we look to adjust the provision of support? And in addition to this, where direct payment excess has been built up, we do have the authority, and it's within the contract at the outset, to reclaim unspent direct payment monies. So there is that oversight on the public purse, if that assists.
Thank you, Richard. Okay. Is that you finished now, the presentation?
There's just point 10.
Okay.
And it is that annually publish information of all direct payments. And this is something that we're working towards. But again, we need a lead from the Welsh Government to do that. Okay.
But as Amy said, it's part of our performance, so we will be monitoring, shall I say? Thank you, Richard. Thank you so much. It's been very interesting, your presentation, so thank you.
Yes, again, very happy to hand over to Helen and Amy, but again, a very thorough report. Just wanted to just highlight, obviously the report shows a lot of really good work going on, and importantly, what work is going towards those areas of improvement. And I just did want to flag, obviously, all of these inspections did take place during COVID and during those restrictions. So, to bear in mind that the identified areas of improvement really are kind of in that context, and there are things that have been identified, are being worked on and being improved. And obviously, we're working not as we wanted to do during COVID, which explains some of the, not excuses, but explains some of the areas there. So were you going to kick off, Helen? Oh, sorry.
Yeah, thank you.
Thank you.
So in the report, we highlight about 4 unplanned inspections. This is unscheduled, sorry. So CIW just turn up and inspect our services, and then 1 scheduled inspection. So all our regulated services are inspected by CIW against the regulations that we have to achieve. As Councillor said, we had there were 11 areas of improvement identified across both service areas, and excuse me, really sorry, my phone. 11 areas of improvement were identified across the different service areas, but none of these were non-compliant. So these were just recommendations. So just to take you through a couple of areas. So with the Hollies, one of our care homes in Ponstalice, which was inspected, the report shows some really good outcomes, talking about people having positive experiences of the service, clearly benefiting from their time, people living in a service where they're safe and happy, residents commenting, so that the inspectors ask the residents, and they ask family members and carers if they're visiting as well, ask them what they think, and they've said they're really happy in the service, so that's excellent. There were some areas highlighted around the improvements to the environment, and there is an attached action plan which shows, but we are, so those capital improvements around making the environment dementia friendly, so that's to do with the sort of colour contrasting walls and some environmental improvements in the gardens as well. That's ongoing. And also gaps in training arrangements and records, and has been mentioned already. I think all of these are in action and in progressing, and I think we were entirely limited, I suppose, with no, sorry, I want to say first, to be reassured, staff are trained in their induction, staff are trained according to their continually with their continued professional development. But there were occasions during the period in terms of the record keeping was quite difficult to keep on top of. I think sometimes the refresher training as well was difficult to schedule in, because if we suddenly found that we were short staffed because, you know, someone couldn't go off site to go and do the training. So there's been these kind of challenges, but what's good is that we have caught up with them, you know, that there's and deadlines are in place if we haven't caught up with them, particularly on some of the, there's some ones later on around people's personal development plans. So they will always have team meetings and one-to-ones, but they might not have had that recorded. So just some reassurance there. Just wanted to pick up the next one was around Tea and Ally, the care home. And saying that people are very happy living in a service that actively supports their well-being. There's a clear focus on supporting people achieving their goals and the importance of maximising people's strengths and achieving positive outcomes. Some really nice comments from the residents there saying, I love the staff, they're so kind and considerate, they really care about us. And feedback from the relatives, as I mentioned, they've picked out some of those. So saying it's an excellent service, staff are so kind, talking about their family members, saying they're a different person, they're so much happier now. I mean, I think it's all of us, you know, are incredibly proud. It really does, incredibly proud to be associated and our teams working in this. And they're saying communication is strong and care workers are well supported by the senior staff as well. So they are managers on the sites and our registered managers as well. And then Bonamine House, so this is our assessment and reablement service as well. The inspection was earlier on this year, and the report highlights about the senior team being well led and place people at the heart of the service. People's independence is actively promoted, and they really benefit from the short-term period of reablement. And you'll know from our performance information that we bring to you as well, we get incredible outcomes from those services as well. And people have said it's a lovely place, the staff are excellent, and they really push me to do things for myself, as the quote is. So we obviously want to promote that independence. Again, there was some improvements identified around staff records containing the relevant information and gaps in staff training records and around those annual appraisals, but there's a full action plan in place and has been implemented, or in the progress of being implemented. And then finally, just in terms of the residential sites that have been inspected just in the last year and a bit, Mice Glass Community Support Unit is, and so that's the report highlighted that the service is well managed. People are happy at the service and have their physical, social and emotional well-being enhanced by committed staff. Care workers treat people respectfully, ensuring their personal preferences are recognised. I'm just pulling out some highlights here, but it's all in the report. And CIW found a supportive and open culture of the service led by an approachable and responsive senior team. Again, there were some environmental improvements, including redecoration, some chairs, that type of environment upgrading. And again, that's been quite limited because of the COVID period. We've obviously only had essential staff on site. We haven't allowed as many sort of trade support coming in as we may have in non-pandemic times. But that's being addressed now. So all areas improvement identified in the previous visit had been achieved as well. So that was reported in the Mice Glass report. Hands over.
Thank you. In terms of the domiciliary care services that were inspected, the inspection took place between the 24th and 28th of May 2021. And the services spanned by the registration for Swansea Counselling, there are 4. There's the short-term reablement for adults service, there's the long-term support for adults with complex care and support needs, and there's care and support for people with mental health conditions in the supported living, which is in Llanfair House in Norton. And then also the short-term crisis intervention for children and their families, dom care support to intervene and try and keep those situations, try and keep children home at the earliest possible stage. So the full report is appended, but I'm going to do some highlights as well. And these are not specific to any of the particular 4 areas that these cover across. So the team is well run by an organised and committed management team. There's clear oversight from the RI, ably supported by an experienced team of managers. The care staff are well trained, they're well supported and listened to. Communication is used well and effective, ensuring that staff feel linked into the service and supported through supervision. And I wanted to draw that out really, because trying to link in, nearly 200 staff who are working in the community during a pandemic, I really wanted to draw out and think it's of note that was something that the inspectorate actually noted and made comment about in their report. People are well supported by well-trained care staff who want to make a positive difference to their lives. Key one for us was that the care workers had a clear understanding, a good understanding of the safeguarding process. And of course, given that the inspection took place during May 2021, care workers are clear on current infection control guidance in respect of COVID-19. And I think bringing ourselves forward a year from May 2020, when there was so much confusion around PPE and infection control, it was really positive to hear that it was evident to the inspectors that there was a good understanding. I wanted to just highlight the training and comms recognition, particularly just because in the same way that Amy mentions about our ability to deliver face-to-face training, but also our ability to release staff during May 2021 when we were so impacted by COVID absence within the service as well. It was really proud really to have that drawn out by the inspectors. There were 3 main areas for improvement that were evidenced. One was that the evidence in identifying personal outcomes and means of supporting individuals to achieve these wasn't consistent. So for clarity, the inspectors did find good examples. However, the standard of the documentation wasn't consistent, is what they drew to our attention. We've got an action plan and we've made progress towards improving that. There's been a considerable amount of improvement work in training internally to improve the review documentation generally. We've also introduced during the subsequent period what we call patient-related outcome measures and patient-related experience measures, PROMs and PREMs for short. Substitute the word individual for the word patient really, because they are health app really, called the ProMap app. We started it in the Home First programme, and we've trained last week on the 2nd to the 11th the home care staff around using this with individuals. So what it does is it looks to talk to the individual who's received the service, to ask about their outcomes, were their outcomes met, and also their experience of the service. We've trained the staff because obviously whilst there are some of our individuals who can use it themselves, they do need some support, a lot of individuals, to partake in the use of the app. It's an app, it's a phone-based app or an iPad-based app. So that's a real development for us, and it's really allowing us to hear what people say, what people think about the service, and show our engagement with them. Second area for improvement, there was minimal evidence that individual and their representative views were informing the reviews that were undertaken by staff. So in terms of our progress and our actions against that, we've got improved personal planning documentation are in the progress of the review. Senior community care assistants are trained in the development of personalised outcome focused care planning. That training is planned for December 2022 to refresh that outcome focused care planning. We've also got a post, we're recruiting to a post that is to support the implementation of access care planning system to make sure that all the benefits of the new system around personal planning and outcome focused planning are achieved through the system. That post has gone out and it's gone back out because we didn't really get enough sufficient applicants for the post. I think there were a couple of complicating factors, and I think there's a little bit of context that I would like to just set around the documentation. So the inspection took place in May 2021. I'm sure you will all have been aware that we introduced WCCIS in April 2021, the month before, and I think it's fair to say we had a bumpy starting ride with that service. I know when the inspectors came in, they physically had difficulty in accessing some of the records in order to carry out the inspection, directly linked to some of the challenges that we had around CCIS, you know, within the first 6 to 8 months. But obviously this is in May, this is in the month after we went live, and we did have some problems. Also, in terms of having the signature of the individual, the representative in their paperwork to support their planning, it often wasn't possible during COVID because we were remotely working and we weren't going into people's homes to get physical signatures from them for all the reasons that we're well rehearsed around. All the reviews that are currently take place in person, and we've got a new signature sheet that's been developed within the service to capture the evidence of the discussion. I think in the verbal I know in the verbal debrief that CIW gave us, they were really keen to point out that their concerns were in respect of the evidence and the recording to demonstrate the above regulatory requirements. They interviewed staff, they interviewed people in receipt of the service and their representatives, and they were clear from the discussions they had with people that we were listening to people. We did have their outcomes. We were working on, but we weren't evidencing consistently enough in our documentation, and that's where they were asking us to make an improvement. So what they were hearing from people and staff's voices wasn't borne out in our documentation, which is an issue. But in terms of the service we're providing, they were hearing that it was meeting the required. And I think I've got to say, given the timing of the inspection and the impact of COVID on the operational delivery, in addition to the significant challenges linked to the introduction of CCIS, the report was really pleasing testament to the teams. So we decided we'd implement a new care scheduling software as well. So we've done that as well. So that's just my reflections from the home care bit of it in particular.
Thank you, Helen. Does anybody have any questions for both Amy and Helen?
Question or comment of the motion?
When I read the summary of the report, I wasn't exactly clear what framework they were using to do the evaluation or the assessment. I mean, we've already talked about outcomes, and that's fine, but I didn't see much reference to what you might call inputs or processes or outputs. And you've mentioned already that the process bit was difficult because of COVID, and the IT wasn't working well. Yes, the nice stories from the different organisations, but they had a too familiar ring to them in terms of, we were basically saying the same things about the 3 different bits of the service that they visited. And I just wondered if we're clear, or they're clear, about the analytical framework that they're using to compare one bit of the organisation with another and one local authority with another.
Not sure I can comment on CIW actually themselves in terms of what it is, but what I would say is they inspect 4 areas that we look at, but compared to the regulations that we have to follow. So they're looking at wellbeing, care and support, environment, and leadership and management. So as you say, that kind of input and the processes, they are looking at those in terms of the regulations. I feel I haven't answered what you're asking though, so you come in already. No,
Well,
it's okay.
let me just test that. In terms of well-being outcomes, what would a well-being outcome look like in those three different settings? Would it look exactly the same? Would it be different?
I suppose as we've referenced in the previous report, it's about those individual outcomes that the person wants to achieve. So it's about looking at their care and support plan that they have and the outcomes they wanted to achieve. It's about talking to the individual. It's about talking to the staff. It's about talking to the parents, carers, others. I don't know if, because this came up in the other one as well, didn't it?
I think probably it was, I can, having listened to Amy and myself, I understand, I recognise what you're saying about similar comments being made. I suspect there was a limited lens given when the inspections were carried out as well, in terms of, I mean, the home care inspection, even though it was a scaled down inspection, didn't feel like a scaled down inspection. But I suppose, yeah, I can only say the same as Amy, really. I'm not sure really if there's.
Can I just say, both services need commending on what they did during the pandemic and since. And I can only think how proud we are in Swansea that you were both there for everyone. So thank you.
Well, yes, Chair. I mean, I didn't intend to imply any criticism at all of what the service was doing. I was more concerned about what seemed to be a relatively fluid evaluatory framework. I mean, if you take out outcomes, you say that the individual specify the outcomes, fine. So if one of their markers is, of the 20 people that were being cared for at the time, 19 met their intended care outcomes, and that's a good tick. That's fine. But that's a sort of specified outcome by a range of individuals, not an organisational outcome that we have specified or that you've specified.
I guess you'd have to take that up with CIW,
was gonna say,
I suppose, really, wouldn't you? Because they're the ones setting the.
Thank you. We've got two questions now, one from Cheryl. Cheryl?
Yeah, thanks. I just wondered, having read through the reports, and you sort of answered it because you felt that, or that you didn't feel like they were limited assessments that were being done, not the assessments, when you had the inspections. There doesn't seem any dialogue within the reports from the care inspectorate to indicate that there were really quite extenuating external factors at play when, you know, during these inspections, either in play or that you were recovering from, and obviously with the staffing issues that were still ongoing. And I just wondered how, you know, how you actually felt about that. That's a sort of like a question, maybe an unfair question, but I read through it and I didn't feel that they were, although that they pointed out many good things, I didn't feel they had taken those factors into consideration, which I think was a little bit unfair. But then the only thing that jumped out at me, and I can't remember which of the locations it was, but it was to do with the medication, and adequate records hadn't been kept for the medication. And you have put that, you know, obviously there are now robust processes in place for that. But I just wondered whether that was something that had been taken, that point had been picked up and taken right across the board of all of the establishments, you know, for that clarity.
It was to you and Arloyd, I think. That, yeah, sorry, Amy.
No, certainly. I think 2 points there. If I take the medication one first, actually, sorry, I did mean to highlight that when I was going through, because you're absolutely right. I think that's myself and the managers, when we were talking through, when we have the report, is obviously anything around gaps in medical medication administration records, you know, raises a concern. We have to look at that, and just to be reassured that the action and the recommendations have been completed. There's a robust monitoring process in place on a weekly basis across this site and all our sites in terms of medication administration. I think reassurance there was no harm to the person in this scenario. If there was, we obviously have any obligations to report to CIW and Care Inspectorate, around social care as well, around any medication errors. So we have robust processes in place there. This was in relation to PRN, so pro renata administration, so as required for the individual. So and it was about that being recorded on the charts as well. So the management audit system is now in place. Well, not now in space, but just ensuring it's robust. Again, it was about the time period we were in at that time to identify if there are shortfalls and to ensure that staff follow the safe systems of work. So we've got checks and balances in place now across all the services, or we ensure, sorry, I keep saying now, we always have had them. I just want to reassure you, but this is about robustly having them in place as well. I think, can I make a comment on the CIW point as well? I think, again, it's probably one for CIW rather than us, but I think we're inspected in the same framework as every other registered service across Wales, I suppose, and all of us have been working through the pandemic. So I suppose that's perhaps why it doesn't come out as strongly in the report, and we've just been working through it in the same way. So I suppose that would just be
in the verbal debrief. There was quite a lot of acknowledgement in the verbal debrief we had from CIW, but I don't think that's necessarily. We do tend to labour it though, I'm afraid.
Thank you both. Chris, you have a question?
It's a couple of questions really and a comment. The comment that going on what Cheryl just said. Part of the problem with a lot of inspections, they are just snapshots of what's actually happening in those homes and in domiciliary care. So to some extent, you need to have a collection of them to have a truer picture right throughout a year or 18 months or 2 years. And I think having looked at this and the fact that, yes, there was a pandemic and we did work from home, and there was a lot of very different methods of working applied through that. I think the report is good, and I think there is issues. There are issues in it, yes, but I think some of those issues, dare I say, are very minor issues compared to the overall care of the people that we are looking after. That's the first thing. The second thing is taking Tony Beddoes' point, and I understand what Tony's saying. There is an organisational output or input or whatever. We are not measuring the same thing as CSIW. It's like measuring apples with apples and pears with pears. They don't always do the same thing. And I think obviously the judging of whether people are feeling of well-being, it's really got to be a subject that you can't really measure that. I don't think there is a scale that you can use to measure people's well-being. I think it's more important if we get the reaction from the patients themselves and from the families. And I think that gets the best description of how people are feeling within the residential and the domiciliary care. Finally, Chair, I'd like to, I forgot to declare an interest at the beginning because my daughter works for the social services. Thank you.
Thank you, Chris. I don't think there was a question in there.
There
No.
was a question in as much as I don't think you can measure well-being on a scale. I don't think there is a scale there. I think it's a question of asking the patients and the families.
Thank you, Chris. And the comments for themselves, I think, yes, in that report. Thank you. This blinking thing. Thank you for your presentation. And we go on to item 8 now, and over to you, Dave.
Yeah, thanks, Chair. Not sure how you want to do this because the report has already been presented to Council, so Council has obviously received the report and asked various questions at the time. I suppose this is an opportunity if there were particular questions, more detailed questions that the committee wanted to get into that perhaps Council itself doesn't lend itself to. So unless you wanted me to give a summary that I've given previously and reflect on the numerous conversations we had during the past year, given that you've already had a long session, I'll probably assume that people have either heard my presentation, have had a couple of opportunities to read the report. If there are detailed questions that anybody wants to ask, then I'm happy to take them.
You, Dave. Are there any questions for Dave on his report? You've all had a chance to read it. No questions. Thank you. Gosh, we're going well now. And we go to item 9 now, the work plan. And I thank you all for attending. It's been a really interesting meeting. And again, support the staff for all the good work they've done in social services over the last 2-3 years. It's been amazing. So thank you all. On to item 9, the work plan. Anybody got any comments on that?
Is this the regional transformation plan?
Sorry?
Is this the regional transformation plan?
The regional,
Update on adult services transformation.
where are we now? Oh, yeah, right. That's on the 20th of December.
And
March is the one, is it? Liz is telling me it's in March for the regional one.
Right.
Okay,
Yes, just
Any
I read
other-
somewhere a phrase complex care in the regional transformation plan, if I've got my notes correctly. I wasn't sure what complex care defined as these circumstances. Perhaps it's not a question to ask today.
bring it to the next meeting. Actually, we can just give you, because there is
A
a definition.
definition.
We have a particular definition, but it's one of the regional transformation programmes that ourselves, Neath Port Talbot Council and the Health Board and the third sector and providers are involved with as well. And it's looking at complex care, but I would get it wrong if I tried to get it sort of defined off the, without having the reference.
thank
to
you,
that.
Amy. You happy with that? Okay. With that, I call the meeting to an end. Thank you all so much for attending.
Thank you. Bye-bye.
Thank you all.